Hello and welcome to the Chiropractic Toolkit's video training module. In this video I'll show you how to document the new patient's second visit, which includes the report of findings, assessments, treatment plan, and the first visit. In the next video I'll get into documenting the routine office visit and all the details of treatment, including the chiropractic adjustment, therapeutic modalities, and active rehab therapy. As you'll see again, what makes these macros special is that they're very systematic and there's lots of patterns throughout, which does make the learning curve very short. These macros are all about having documentation that's very compliant and audit proof while still being very efficient. So let's get into the macros and properly documenting the second office visit. Now by this visit you should have already documented the initial consultation and the examination, which we went over in the previous video. And by now you should have all the diagnosis codes posted up in the right hand box of ChiroTouch that you want to use, because the macros are going to automatically pull from that list. So you want that list complete before you work through the second visit macros. If you need assistance on what codes to use, check out the newly updated ICD-10 chiropractic coding cheat sheet on the website we have of ChiroToolkit.com. So if you click on the bundle package, which includes the ChiroTouch macros, and it also includes office forms, which there's well over 50 forms included, and one of the forms of which is the ICD-10 chiropractic coding cheat sheet. What we did is we did all the work for you. So we filtered through 65,000 diagnosis codes that ICD-10 introduced, and it listed we listed the most commonly used chiropractic codes by category, and it's all on one-sided sheet of paper, so no fumbling through a bunch of sheets or books. Everything's condensed with the most commonly used codes of every condition, whether scoliosis, extremities that you have. So again, you can buy this, purchase this form a la carte, or it comes in the bundle package kit. So let's get into the macros and properly document the second office visit. To enter the chart notes section, click on the chart note button. Now, because we did such a thorough job with the subjective and objective part on the first visit, the second visit's pretty brief. We're going to focus more on the assessment and the plan section of the SOAP notes. So for the subjective, this button is very fast, so click on the consultations, which again you remember from the original introduction video that this upper right hand corner of all the home screens is the major event section, which visit 2 is a major event because that is report of findings and more thorough assessment. So again, getting back to subjective, you're going to open the menu of consultations. Now below this line, I should say above this line on each of these screens is first visit day 1. Day 2 is below that. So obviously you're going to click on the button that says day 2. Now from the first visit, has their subjective changed? For most new patients on the second visit, they haven't changed too much. So if they have, then obviously select the appropriate button. So that's just going to give a nice little introduction. So, John reported that his complaints and symptoms as reported the last visit have not changed since the initial consultation and the examination. And then puts reference to look at the complete history of present illness on the previous visit. Okay, so fast there. Click on objective. Now objective, again, always go to this upper right hand corner to open up the main macro screen. And again, above this line, we already completed on day 1, so day 2 is below that. Click on day 2. This is going to get into the first routine examination that we have, which is just confirming everything we found the first visit. So where's the subluxations today? Let's say L5 sacrum and T8. And then it's going to flag you to check extremities. So was there any joint tenderness or restricted range of motion? Let's say we did not check extremities today, so we didn't check them in any region. If you want to comment on antalgia, whether it's, again, changed, let's say it has not changed since the last visit. If you remember on the last note, we did talk about antalgia. So let's say it's antalgia same since the last visit in the lower back. And there's slight difficulty walking. Let's say restricted movements. There you go. So then we're going to go back to where we were. So if we click back, so there's where we were, day 2, and then we did comment on antalgia in this particular example. So then we're going to get into treatment. Now treatment is broken up to, again, whenever you see the intro button in this upper left hand corner, you're always going to start with the intro. And we're going to get into chiropractic adjustments today. Now, modalities and rehab, manual therapy, massage, we'll get into those on the next video on the routine office visit. So for sake of brevity on this particular video, I will show you how to document the chiropractic adjustment portion. So click on adjustments. Now again, they're broken up to Medicare and non-Medicare. And that's because we want to make very compliant notes that automatically input certain diagnosis codes and certain procedure codes into ChiroTouch. So you all know with Medicare we need the AT modifier, so you're going to assign those codes, and we did the work for you to make that easy. So let's click on non-Medicare active. What did we do? Did we do a 1 to 2 region, 3 to 4 region, or 5 region? Let's say we did a 1 to 2 region today. Click on the intro always, whichever one we did. And what that put in is chiropractic adjustments, 1 to 2 regions. Manual Gonstead adjustment was performed today on areas of subluxation. So what did we do? Let's say we did lumbar, and we did L5, and it was a PRS-M. We did it on side posture. So there is all you need to do for the objective portion on day 2. So let's get more technical with the assessment. You remember the last assessment on day 1, we did more of a working diagnosis. Now we have official diagnosis because we took the time to organize them how we want them. So again, you're going to, on the assessment box, you're going to go up to this top right-hand corner, and day 2 is below. And again, we divided up to non-Medicare and Medicare based on the PQRS codes that we need to attach to the actual Medicare visits. So for this particular one, it's non-Medicare. What's their prognosis? Let's say they have excellent prognosis. How do they feel post-treatment? Again, all these points that we put in these macros, it's to meet the most compliant standards that we can. So for each and every visit, we have to comment on the treatment response to that particular visit. So how did they follow? How did the patient feel following treatment? Let's say they had slight relief and increase of range of motion. Is there complicating factors? Let's say there is a complicating factor. Let's say they have a very stressful job. So biomechanical stresses of job, maybe the chronicity of the problem. Those two might be a common, there's a full list of other complicating factors you can dive into. Is full recovery anticipated? This is going to help you. So let's say we get down the road and there's residuals at the end of treatment, or maybe treatment's taken a little longer. So let's say full recovery is anticipated. Will treatment time exceed norms? So this is going to set you up for, let's say we get to the end of the treatment plan and we realize, darn it, we didn't put along a treatment plan as what they needed, so we need to extend the treatment plan. Or maybe they have a spondylolisthesis or severe muscle spasm. Maybe they have conditions that we think it might exceed the norms. In this particular case, maybe we'll just say, well, not, but it's whatever you, as a doctor, of course, determine you want to put there. So that is day 2, and it puts all this in. And again, if you go to ChiroToolkit.com, on the ChiroTouch macro section, we did include sample notes, and there is a day 2 sample note section, which will give you an example of what all this looks like as far as how it's formatted and printed. So again, follow the arrows. Now this arrow leads to the right, which we don't need to be redundant with this because it's a non-Medicare. So it's going to dive into X-ray findings. Now this is another highlight feature of these particular macros. So we're going to get into X-ray findings. Again, always click the intro button whenever you see that upper left-hand corner. And we're going to comment on X-rays. Maybe you reviewed other films or other studies, but let's say X-rays and they're taken in this office, or maybe they brought in X-rays from another doctor's office. You can select that. Lumbopelvic spine is what we're looking at. Now we're going to get into particular diagnoses. So let's say we look at their X-rays and we do see a spondylolisthesis or a spondylolysis. You're going to click on this button. And I won't open all these buttons for you, but let's get into this menu here. So here's where, again, we broke it up to specific diagnoses, and we included the ICD-10 code to make it easy for you to attach the link. So again, just to refresh your memory on how to do that, if we're going to click on this button, let's go into Setup, and you see the M43.12. If we want to assign a diagnosis to that, you open the diagnosis, and there we have it. So you want to find it on your list and add it and click OK. Now every time we click that particular button, it's going to input that automatically into the diagnosis section of ChiroTouch. So let's say this patient does have a spondylolisthesis at the lumbosacral level. So I click on that, it's going to put that in automatically. Let's say go back to X-ray findings. Let's say we also see some degeneration. Click on that. And then if we go back to X-ray findings, let's say there is nothing else, click back to assessments. Now it's going to lead us back to where we were, and we're going to get technical with outcome assessments. Now you could of course do these in ChiroTouch or in their outcome assessments app, or you can do it here. So let's open, I'll just show you what the features this macro set has. Outcome assessments, again, click on the intro. Is this a baseline for this particular visit? It will be a baseline. And we can put in, now the way this is worded is you don't, as long as you do the outcome assessment forms, have the patient complete them either on paper or using the ChiroTouch app. This references it, but it also sets up goals. So we could get specific with the actual assessment. So let me just give you an example. Let's say we documented back disability index. So if I run through this, the total score, let's say, is out of 50, which leaves us with severe disability. What's the highest categories they had, maybe standing and sitting, and what's the primary goal based on the back. So let's say we want them to sit more than an hour, and there you go. So every outcome assessment tool that you have at your disposal through ChiroTouch or through other means, we have it all worked into giving not only how to score it and rate it, but the description of what it means, and then actually setting up a treatment goal. Now that's very important for a treatment plan and documenting medical necessities, to have an actual goal attached. So there you have it for the assessment. If I start at the top, and we'll get into the current diagnoses. It pulls from the ChiroTouch list, so you want that done prior to doing this particular office visit. You have prognosis, you have treatment plan, you have post-treatment change, you have complicating conditions, and then you have X-ray findings, and then outcomes assessment. So that that is how to document for the assessment portion of your soap notes on day 2. Now we're going to get into treatment plans. So as you know, in order to meet medical necessity and to make insurance companies happy, the treatment plan must contain more than just the frequency of visits. So it's a lot more than just saying I want the patient to come in 3 times a week for 3 weeks or 3 times a week for 4 weeks. So as you all know, there's a lot more to a treatment plan than that. The treatment plan must include, for instance, the diagnosis has to include short-term goals, long-term goals, all the services you prescribe and the rationale for why you prescribe them, as well as a visit schedule, which shouldn't be much more than 4 weeks until a follow-up examination is performed, and then you can start an entirely new treatment plan, which can be documented for further care. So 4-week intervals, we want to redo all this particular assessment and treatment plan, as you know. So these macros have you covered on all that with preset plan options. So the last section we're going to talk about on this particular training video is the plan. So again, always go to this top right hand box for major events, open up the plan section. Day 2 is always below this line. So day 2, let's start off. Most docs would probably do a report of findings, go over the findings with the patient. So is it an adult patient or pediatric? Let's say it was an adult patient that we went over a report of findings. This documents that we did that, covers all the topics and points we went over, as well as reiterated to them the home care instructions. And then after that, we're going to get into initial treatment plans. Now, let me show you, there's two ways to do it. I'm going to show you the long version first. So the most important part of documentation, I should say, would be the treatment plan. That's what every auditor, every insurance company is going to want to see is your treatment plan, because that's how they establish medical necessity, as well as, you know, documenting progress along the way. So the long version is going to be this treatment plan template button. So after you document the report of findings, click on this treatment plan template. So is it an initial treatment plan or updated? It's an initial treatment plan. It's going to start today, which ChiroTouch populates to today. Is it chronic, acute, or an acute exacerbation? Let's say it's a chronic situation, and they rated it at a 7. Which phase? Of course, we're starting care, so we're at the acute relief phase of care. How many times per week? Let's say we're going to start at 3 times per week, and we're going to do that for 4 weeks. What are we going to do? Passive treatment-wise, chiropractic adjustment. We're going to do electrical muscle stimulation, maybe mechanical traction. And where are we going to do rehab? Lower back. Short-term goal. So what's the average pain we want as a short-term goal? Let's say they start at a 7, so maybe we want a short-term goal to reduce down to a 5. Long-term goal, we want it to go down to a 3 on the QVAS scale. What goals do we want to meet? We want them to sit and sleep better, so without pain. So the long version of treatment plan is here, and that's how you can customize each particular patient. Now, with these macros, we did build in, I'm going to erase this, we did build in preset options. So the efficient, quick way to document a treatment plan would be to click on the initial treatment plans, and we built in preset plans. So 3 times 3 would mean 3 times a week for 3 weeks, and then we do new re-exam and new treatment plan to extend further care. So in that particular example, I said 3 times 4, which is 3 times a week for 4 weeks. So we just click on that button. Again, is it acute or chronic? Condition severity. Where are we going to do the rehab? And there you go. So this is going to cover all the components of a treatment plan: treatment frequency, treatment therapies, rehabilitative therapies, and then treatment goals. So this sets in motion so you have covered all the goals. And when it gets into later documenting progress exams in a later video, we'll show you how to actually document the progress in these goals to keep you on task. Now, to go along with these treatment plans, again, another form that you'll definitely want to look at is on ChiroToolkit.com. Again, it's part of the bundle package kit, or you can buy it a la carte, but it's the treatment plan worksheets. These are integral in my office in treatment. What this does in my office, it's the only paper document that is active, and it actually lives with the patient on each and every visit, because it's the foundation of their entire treatment plan. What it does is it tracks them, let's say a 3 times 3, and there's a lot of different variations of this, so that particular, when you buy this particular treatment plan worksheet forms, you're going to get lots of variations. So we just put one sample there, but it's going to cover each and every visit what we want done. So it's going to keep the patient on task. So that's how to document the new patient's second visit. Make sure you watch the next video on how to document the routine office visit, which includes a treatment protocol leading up to the next examination, which should be performed about 30 days after your last examination. Again, I thank you for watching this video, and I look forward to helping you along the way as you create rock-solid documentation with these ChiroTouch macros.